Welcome to Implementation of New Systems, Module 4. The outline: usability, configurability, interoperability, cost factors and recommendations. Phase 1, team selection. Phase 2, culture and resistance. Managing resistance, pitfalls and how to avoid them, and sharing a personal experience with system implementation. This will be the gist of the PowerPoint. Usability. Usability is a critical component of health informatics products. If the frontline staff cannot use the product, the cost involved to implement it will be essentially wasted. Can staff input and retrieve information for their daily tasks? Does the product increase efficiency with regards to patient care? What is the current skill level of the majority of the staff that will use this product? What type of training is offered by the vendor, and is there a training application for staff to have hands-on practice prior to the go-live date? Configurability means, in terms of software, the way it can be adapted or changed to meet the user's needs. How can this software be customized to meet the needs of this organization? Can it be configured to line up with our vision and goals? Interoperability, the ability of systems to exchange information. Can data and information flow from one system to another? For example, at Kindred at Home, we have the old system, Unity, that is our financial and billing site. Charts are created here first. Patient data is uploaded, and then it flows from Devero K-Link to K-Link, the new system where the staff document. K-Link is on the Devero platform. K-Link is the actual electronic chart, but the database that stores the initial information is Unity. And if these two systems do not communicate, no billing can take place. If something is entered incorrectly into Unity, it will automatically be wrong in the K-Link system. Cost factors and recommendations. The underlying cost of a new system should be weighed equally among concepts of usability, configurability, and interoperability. Just as a seemingly discounted system that is not user-friendly would be a waste of money, so would a very hefty price on a system that was easy to use but did not have the capability to communicate with other systems. All four concepts should be considered equally. The recommendation is a system that can be built upon as regulations change, and things always change. A vendor that provides education and a training site for hands-on learning, and a system that can communicate with current databases. Phase 1, team selection. This is your implementation and planning team. Want to choose team members based on new system requirements and functionality. Team members should come from all areas: frontline staff, physicians, nurses, pharmacists, human resources staff, and IT staff. They should possess knowledge and expertise of functionality and plans for new workflow processes. Should also consider adding a consultant to the team. Consultants can add skill to support the team, help build functionality into specific applications, and can support the team without taking away from the other duties of the project manager. Phase 2, culture and resistance. The phrase "lead with culture" means to educate and communicate with everyone prior to making changes. Management of teams and creating a culture of longevity means communicating with your staff. allowing time for feedback and questions, setting a positive tone when it comes to big change. Resistance is a reaction to negative perceptions of change. If education is provided before change happens, the weight of change is not as heavy on employees. People have time to mentally prepare and can more readily accept the positive aspects of change. Education and communication allows the frontline staff to feel valued and included in some way regarding these new changes. Resistance comes from staff because of a loss of predictability. A loss of security then produces panic and fear. Loss of convenience, or doing things the same old way, and a perceived loss of relationships. For example, they might not be able to work with people that they've worked closely with, and people just really fear change in general. Managers must plan for resistance. They have to be aware of its potential destructive impact and educate staff prior to the implementation of change. Managing resistance. The key to managing change in professionals is to solicit their buy-in. As professionals who participate in research, value evidence-based practice and knowledge, these participants will appreciate the mutual respect of being given the information up front. With them as the innovators and early adapters, as in Rogers' innovation adaptation curve pictured here on the slide, suddenly your physicians and nurse managers are able to speak directly to the frontline staff regarding changes and to support the direction your vision and mission is headed. Physicians and nurses, being leaders in their fields, should always be included as key members in meetings. Producing their buy-in early is very fundamental to rolling out big change. And empowering them as frontline leaders, even when they don't have the title, allows them to be able to spread the word and to push forward your system updates and changes with a positive spin versus things always coming down from the quote-unquote the top. Pitfalls and how to avoid them. Adequate planning is key. Making sure to account for the time and resources needed for the implementation team and project manager to devote to the development of the project and accounting for hidden costs will prevent surprise issues midstream. Implementation team members cannot be expected to maintain their current jobs and also be integral members of the project team. Take care not to begin adding features and functions that were not in the initial plan, as this affects the initial timeline and can increase costs. This is referred to as feature creep. If planning is done adequately before the project starts, deviation from the implementation strategy will not be necessary. Adequate planning is essential to success. Frontline staff need time to train and should be provided adequate time and education prior to the go-live date of any new system. Not enough can be said about communication. From the top to the bottom, people appreciate communication, and you will be less likely to have major pushback with early and frequent communication. This can be in a variety of forms: emails, posters, bulletins, webinars, in-person meetings, etc. So, to discuss a personal experience, I was working in home health on paper charts in 2012. The initial transition from paper to computer charting was not communicated well to us at all. Not so much myself, but many of my fellow nurses lacked the computer skills required to make a successful transition. We lost staff, and the initial devices were heavy and cumbersome. A lack of education on the front end, I believe, and staffing challenges added to it, caused initial frustration to be very high, and charting that turned out to be very late. Untimely documentation is a pet peeve of mine, and billing doesn't happen without documentation. Many of us nurses had to take documentation home. We had to chart all weekend. We had to take our computers on vacation to catch up. The initial system that they tried it did not match our workflow processes, and therefore it was just really hard transition. The next rollout that happened in this January of 2018 was communicated by the company earlier, starting several months ahead. However, the education sessions were not advertised or even communicated at the local level as being so important, and many clinicians did not prepare. This left a mess for more than a month. Even those of us that took the classes, they were so fast that it was hard to really grasp the pieces that you were going to need because everything was so different. Much of the training or quote-unquote dummy sites offered did not allow users to actually walk through the entire patient scenario, therefore proving to be useless and a waste of time and resources. The new updates that we have coming now in January of 2019 have been much better communicated by the company, and learning plans have already been scheduled and loaded to our Relias accounts, which is Relias is our training site at Kindred at Home. This has been done as much as 5 months ahead of the changes. These classes have been made mandatory and will have a due-by date. I believe this creates a better plan for implementation of system updates. And that is the end. There are the references.